Townsend. Okay, good. Sorted that out. Whew. Didn't want to leave that open. Right. I have scoliosis. Can I have breast surgery? If yes, do I need to notify my neurologist? Neurologist for scoliosis. Okay. Have you got neurological symptoms then? Okay. Anyway. So scoliosis is a curvature of the spine. And when the spine is curved, the rib cage can be tilted. And when the rib cage is tilted, there can be breast asymmetry because of the tilt of the rib cage. One breast projects more than the other breast. And so the bottom line is, certainly if you're going to have your scoliosis addressed, you should have your scoliosis addressed first, because surgically, that is, or braces or whatever. You should have that done first before having breast surgery, because we have to we'll have to compensate for the tilt in your. We may have to compensate for the tilt in your rib cage. It depends on how much of a tilt you've got. You might not have a significant tilt, but and therefore a sort of an apparent asymmetry. So you might have to use different sized implants. So there are all sorts of issues you can get with people with scoliosis. And if that's the case, if you have got asymmetry and a tilt to your chest wall, then that will be best getting fixed first before having breast surgery. Now, if you don't want to have scoliosis surgery and you're happy with your with that side of things, and you're just under sort of investigation, just watching, observation, is that the word? Anyway, yeah, whatever, observation with the with your specialists, then you could consider having breast surgery. It is always best to notify your neurologist or the doctors looking after your scoliosis, and we would also notify them as well and write to them to say, look, is there anything that needs to be done before considering surgery? But there is no reason why you couldn't have breast surgery, I wouldn't have thought. The only thing is, and again, about careful patient selection and careful counselling with patients in the consultation. If there is a tilt, particularly if your nipples aren't pointing straight, if they've got a bit of a tilt to your rib cage, breast implants can accentuate that. So if you've got nipples pointing in different directions or pointing one way or the other way, implants can accentuate that. You can imagine, like a boat that's gone a bit off course, then it carries on going off course. It sort of gets more off course. That good analogy, the further it goes, gets, So it's like that. It's like a boat that's gone off course. The implants can accentuate a discrepancy in an angular direction if there is a tilt in the rib cage. So that's something, again, we'd have to look at, and just not a lot we can do about it short of fixing the tilt in the rib cage, which goes back to having your scoliosis fixed. But if you're not going to have that fixed, then we might have to accept it and just be aware of it preoperatively and just say, look, that's going to happen, that might look more, your nipples might look more asymmetrical if there isn't a tilt to the angle. But we could try and sort of balance out the volume. So I'm out of questions. If you've got